Hi, my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today, let's go over how I remove difficult and tenacious calculus. And before we get started, if you want to learn even more about the dental hygiene career, I have a free RDH video checklist on how to become an RDH, whether you are in high school, college, you're considering changing careers, or maybe you've recently graduated from dental hygiene school. No matter where you are on your RDH journey, I'll link below my free RDH video checklist for you to learn everything there is about this amazing dental hygiene career. And without further ado, here is tips for tenacious calc. So whenever there is a difficult piece of calculus to remove, I still go back to what a random senior dental hygiene student told me when I was a freshman preparing for a clinical exam in school. I remember she said to use everything you've got and see what works. So if there is, to this day, 9 years as a dental hygienist, if there is a difficult piece of calculus, I still do just that. I use what I've got, starting with the ultrasonic. So the ultrasonic scaler is always a great tool to start with, and it really removes the bulk of a large piece of tartar. No matter how tenacious it is, it gets the bulk. I feel starting with the ultrasonic for me works best. Then I always go in with a scaler next. A hand scaler for me is my most comfortable instrument, especially for calculus detection. So it helps me to feel what I'm removing and if there's any little grainy pieces of tartar left. I know that it's there and I can get in there specifically feeling what I'm doing. Sometimes we all know that calculus can be burnished, right? So in this case, well, whether it's burnished or not. Next, I usually go in with a curette, but especially if it's burnished. I feel Curets seem to help me with burnished calculus because you can kind of remove layer by layer a little better. Again, this is all in my opinion what works for me. This is in no way a dental hygiene educational video from an instructor. It's tips and tricks from me, a clinical hygienist, a non-dental hygiene instructor. Okay, so again, this whole video is all for a difficult piece of calculus, right? But I also do this with all of my SRPs. I go back in with the ultrasonic at the end because I feel like it's smooth, but I'll still go back in with the ultrasonic because I really want to make sure that the area is irrigated and the water lavage motion really cleans out any residual debris out of there. So that's kind of how I finish. But then lastly, I check it. I check it with floss first. I feel like with the floss, you can really wrap the floss around the tooth and be able to feel if it's smooth or not. And if you happen to feel a little bump, like there may be a little piece of grainy tartar still there or a little clickable piece, whatever the case, if you feel that something's there, sometimes it's hard to detect where it came from with the floss. So then I will go back in with my Explorer and my Air to see if maybe I can actually view it clinically or to feel exactly where it is. So if you're still having trouble, you're like, I know something's there, I just can't figure out where. You can even use that probe end of an Explorer to feel for it. The probe is sometimes longer than the Explorer, so if you're dealing with a really deep pocket where the floss can't even reach, you can kind of use your probe as an Explorer. Then I'll do all the motions again. So once you've found this piece, I will do all the motions again. Ultrasonic scaler, hand scaler, curette, and then ultrasonic again. And then again, I'll check with the floss, Air, and the Explorer. If it's smooth, then great. If you're still unsure, you can always ask your boss or the lead hygienist on how they prefer you to handle this situation. Do they prefer you to take a post-op x-ray to view if there's any calculus left over? Or do they prefer for you to ask them or another hygienist in the office to double check for you? Sometimes that's great to have another set of eyes to help you out. Just ask ahead of time what the protocol is if you're unsure and you'll be fine. Truly, even the most skilled and experienced clinicians still sometimes stress over a tenacious piece of tartar. So don't think it's just because you're new if you're stressing out. We all stress, we're all in this together. We all want to treat our patients the best we can to the best of our ability. And if we do try our best, we will remove that tartar one way or another. We will get in there and we will get it. And again, it's always helpful if your patient is numb. Obviously for an SRP, we want them to be numb, but if they are not doing an SRP and it's just one random tooth area that has a piece of tartar, you can always ask your boss again about the protocol if they are okay with you using some topical gel in that area. I've found that even dipping your scaler, you can take some topical gel out and put it onto your tray and you can dip your scaler into it. Sometimes that even takes the edge off for patients. You just want to make sure that they are comfortable through this entire process as well. And that's it. I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you are a dental hygienist or if you are interested in becoming a dental hygienist, be sure to check out my free RDH video checklist in the description box for everything you need to know about this amazing toothy career. Until next time, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.